Thank you for joining us for this morning session regarding epidemiology. Usually epidemiology means numbers and charts. Mine will be not that nice as Milos with the pictures, but we will focus on some of the data. So my presentation was part of Time or Nori presentation as well, and it's focusing on HIV. I have nothing to disclose regarding this one. So what we will do for the next minutes, we will focus on the outlines. So we will look at the epidemiology of HIV in Central Eastern region, that means Europe and Central Asia, and we will look for the treatment patterns by the 1990 targets. That will be easy to follow. So just to set up the stage, starting 2008, ACDC and WHO Regional Office for Europe coordinated in enhancing this HIV/AIDS surveillance in Europe that is covering 53 countries in the European region, and I'll show you a map of what that means. So, we have a report that is issued yearly around the 1st of December. This is a report, and the data that I will focus on will be the data published this year, but for year 2017. So the key facts was also emphasized by the European Commission officer with his introductory speech. So I will not go through into them. But the fact is we still have a problem. We still have new cases of HIV, newly infected patients in Europe in 30 countries from 31. And the majority of them are men with a route of transmission MSM. This is the WHO map of the regions. They are split by west, center, and east, and they are colorful so you can easily understand them. What that means in numbers, that means that in the whole region of WHO CEE, we have more than 1,060,000 persons which were diagnosed with HIV in 2017. Again, splitting by west, center, and east, you can see that the majority of them are in the eastern part with 80% the new cases coming up, but also the region is covering much more territory than the others. So the routes of transmission, are they the same for the whole region? Because we are here talking about HIV in the region. They are similar from west and center. That means we have MSM, the majority of them, and also heterosexual transmission. The IV drug users are not that important, but you can see that they are the highly transmitting ones also for hepatitis, but they are also for HIV. And in the eastern part region of the WHO Europe, we have IV drug users that are the own increase and also heterosexual transmission for them. It's important to see how are the trends of the routes of transmission in our region. So, there are some declines for some countries. You can see the slip on this side over here, but we still have an increase of undetermined routes of transmission and also for the injection drug use that is on the steady increase. So what will be the estimates? So what should we expect with a newly HIV infected? They are decreasing globally, so you have the red line over here. But look at Europe. This is a dark blue over here. So the Europe, it's kind of increasing if we think it globally. If we split it by region, we have the steady state for Central, East, and West part. Milos covered transmission and he mentioned migrants. Of course, we all know about the problem with migrants in Europe in the last year. They are not coming alone, so the definition that we use for this report was that migrants are all persons which are born outside the country where they were diagnosed. So even between Europe. So you can see that 41% of the new HIV diagnosis cases are reported into the cluster of migrants. If we look by country and by the origin of the people that were diagnosed, Sub-Saharan Africa are leading the top with the countries in the northern part of Europe over here, and the overall split is around 41%. I think this is a slide where Romania is on the last spot, and it's not a bad thing, but we don't have that many migrants as well. So if we address the problem of migrants with HIV, there is a report, a systematic review that is emphasizing that, and I will just point out the fact that 63% of them estimated to have acquired HIV infection post-migration. So post-migration, that means they came to that country and they were contacted with HIV. So we should address this problem because it's present in all the countries that took part into that systematic review. What that means that we are not doing enough with screening when they are newly arrived in the country. We should do more with some subpopulation of migrants that are at high risk of acquisition many years after getting into the country in the UE part. And we should develop some delivery and target primary HIV prevention programs targeted for migrant population into our area. We are at a CEE meeting and we can talk between one and the other. Miloš tell you that we can share data with him and we can do analysis. I think we can share data with everything if we want to target and if we want to cover as many as we can. The meeting that we are in. Where do you think we are going? Is HIV an example for good clinical practice? Have we reached enough? We have switched for a deadly disease to a manageable chronic disease, but we still have the targets that are not reached, and maybe we will look at the treatment by this target. So in hepatitis, 2030 is important. In HIV, 2030 it's quite important. And we have this target that should be reached, and by 2030 we should have 0 new infection, 0 AIDS, death, and 0 discrimination. They are really ambitious, and just split them by the targets. So target number 1 will be to have 90% of all people living with HIV diagnosed. Then from these people that are diagnosed, 90% of them should be on treatment. And from the people that should be on treatment, 90% of them should be virally suppressed in order to reach that overall target of virally suppressed patients. That means no transmission. Just regarding target number 1. This is the progress towards the first one. In the states in the CEE region, they are split by target reach, which is in green, by above regional average and below regional average of target that is reached. So we will not go country by country, but if we look at what WHO will say, that 1 in 5 people living with HIV in Europe and Central Asia is not aware that he is HIV infected. Is that a big number? Is a small number? The idea is when we get to the second one and we look at the map, it's like that. We have regional, and 87% of the people in the western part are aware of their diagnostic and know they are infected. But when we go to the eastern region with center and east, that number is decreasing. So it's not only that 1 in 5 doesn't know he's infected, it's the fact that we also have late presenters. And this is a chart that will tell you what late presenter means. So lower CD4 count than 350 when they diagnose the first test, and we have an average of around 49% for all these categories. Again, what that means is that we have around 2.9 years from the point of infection to the point of treatment. What that means from epidemiological point of view means that we have around 3 years where they are spreading the disease, and also they are gathering comorbidities and they are living with the disease. Will that have an impact? If we look at the map, half of them will be late presenters, and we can work on decreasing that percent and diagnose earlier. Because it's important to diagnose, it is also important to offer treatment. And this is a second goal. So 90% of those diagnosed should be put on treatment. Again, their target was reached in some areas, but we still have above regional average in some countries and below in the others. Cartoon one. that is much more easy to understand is that 1 in 3 people diagnosed with HIV in Europe and Central Asia are not on treatment. What that means, we should adopt the test and treat policies. So we should test and reduce barrier to access for everybody in order to get them on treatment. Can we do that? By the region that you see over here. In the western part, 97% of those diagnosed are on treatment. That is the policy. In the central part, 73% of them are on treatment. In the eastern part, 46% of them are on treatment. We have the antiretroviral initiated policy in European Union. And if we look year by year, starting 2014, you can see that only 4 countries have access regardless of the CD4 when they start treatment. Of course, we are in 2019 and there are steps forward. So with the EASL guidelines for 2015 and with the WHO recommendation, we reach a target of 29 countries who can start treatment regardless of the CD4. And now the last data will say that in 48 countries, the patient can be on treatment regardless of the CD4 count. This is a really important step, but we need to do more, because we need to have availability of the antiretroviral treatment for everybody. And I'm getting back to my migrants, because you can see if we look at this chart, the reddish part are not nice. In all that countries, including mine, we don't have access for migrants to the treatment. That may be due to the change in the policies, and it may be in the future not so restrictive regarding their access, because they will have all the rights and all the documents. But till then, we have to rely on this report. So we want the patients to be on treatment, but it's not enough to give them the treatment. We want them virally suppressed, so we want them to take the treatment. And that is target number 3. Here you have the chart and you have the target reached in more of the countries, the green one, above regional, the blue one, and we have some problems with some countries. But remember, European Union, European regions come with a burden of cohorts of patients that had been on treatment for many, many years. So some of them reaching undetectable can really be a challenge even with the new medications that are available. So again, looking at the WHO chart, we have some differences achieving this third goal. And you can see that in the western part, 93% of them on treatment are virally suppressed. In the center part, we have only 75%, and with that, the eastern part is doing better than the center one. So 90-90-90 doesn't equal 90, as you can see, it equals 73%. I don't know the maths regarding that, but the idea is that we really, if we'll have 73% that will be virologically suppressed of this patient into all the countries that you will see over there, we may want to do more regarding the incidence and the high testing, and we want to do some reports because we want to address achieving this 90-99 target. So people living with HIV that are really virally suppressed by numbers are this one on this chart. So the fourth one means that only 74% are really suppressed in the western part, 46 center, and 26 in the eastern part. And these people are the one that the difference by 100 are transmitting, and this is why reaching the goals will be hard. But we are at a CEE meeting. So are we on track with 2020-30, so to say? Well, this is a full region report. So we have 1,002,000 people living unsuppressed with the virus into this area. In the area that is covered green, blue, and orange. But if we look at the numbers by bullet points, 33% of them are undiagnosed. So getting back to target number 1 is really important to get them tested and knowledge about their disease. But after they are diagnosed, 51% of them are not on treatment. So we should work on that as well. And 30% of them that are on treatment are not virally suppressed, and we should work on that as well. But this should be a global effort for this area because viruses don't know borders. So as patients, myelus patients, we are sharing the HCV infections between countries. This applies to HIV as well. So HIV is a virus and is moving. So instead of my conclusions, I just want to look at the map and to you here in the audience listening. These are our countries. They are maybe split by colors, they may be split by borders, but the idea is to look at them by the people that are involved into it. So we should address the people and we should look for them to get on treatment, even if they are in the West, in the center, and in the East. And by our common goal is to treat HIV and to reach the goals. I'd like to acknowledge all the people that share the slide, especially Taima Nori and Dr. Mădărescu. This is a Dublin Declaration, and these are all the data available, and the slide will be easily available on the website of the virology. So thank you for your attention, thank you for the data, and hopefully by the end of the next session, in order, we will be more motivating to treating our patient and reaching the goals. Thank you.